All right, we are back here in the treatment area at Health Performance Center, and Dr. Jared working with one of our great clients, Bill Becker. And what do you have Bill doing right now, Doctor?
Well, Bill is struggling with a long-term hip condition. How long has this been bothering you, Bill? Couple years. And how long do you think it's been kind of working its way into this position?
Longer than that.
Yeah.
Usually.
So what we have here is a pretty chronic condition, and we're not trying to get Bill to do backflips here, but we're starting to try and get some more good hip range of motion for him. And he's in a position now where he's not going to be, doing heavily loaded exercises, but what we're simply doing is trying to build the framework for that exercise or for more loaded range of motion. So we started off with some simple stretching, and now we're going through some hip abduction here to try and get some good range of motion through the hip. And Bill, as you do this, are you starting to get a little bit more range of motion?
I think so, yeah.
Good. So not only as, we've been doing this a couple of times now, but as he goes through this, we're really trying to get this joint working well for Bill and kind of starting him where he's at. Let's go to the other exercise. Very good. Now this again, he's unloaded, he's sitting down, but what we're trying to do is again start where he's at, and that's starting to load the hip so that he can progress to that next stage of care, which is getting a little bit more active.
And what some folks don't understand is the hip, with hip issues, that could turn into other issues. Everything works together, the back, the hips, the knees, and everything along that line. And that's where here at Health Performance Center, we really hone in on full system health, because you get that full system working, we're going to avoid hip issues or back issues.
Yeah. Billy, you want to take that one?
So, it goes to the back for sure. The back is almost debilitating at times.
Yeah, and, one of the first questions Bill asked me is, does the hip, affect my low back? And absolutely yes. Anytime we see a patient with either hip, knee, or low back pain, we ask about the other areas because they're generally very, very affected as well. Very good, sir. Good. Now let's set up these stretches that we're having you do. Now Bill's to a point here where, again, he's not quite ready to be able to bring this foot all the way above his knee. So we just, again, find him where he's at, and we start allowing him to progress towards that position. So we just modify this using one of our boxes here so that he can start his progression. And hopefully soon he'll be standing and doing this exercise. You're doing a real good job with this back, aren't you?
Trying to keep it straight.
Yeah. Are you still getting kind of the spasms or big time stretching? You're able to kind of isolate it in that hamstring.
I just get through the back into the hamstring.
Okay,
yeah.
good.
And Doctor, we talked a lot about posture in a few of the other videos that we've done. Posture is a huge thing, especially with Bill, improving his posture to where, once again, everything falls into place.
Absolutely. Posture is probably almost as important, if not more important, than how we move. Because posture, if we think about it, that's where we spend about 80% of our day. If we're spending 80% of our day in a position that reinforces a problem, then we're not really getting anything done. So you might have seen me come up to Bill and kind of address his back here. Well, that's the first thing that we did. When he started, he wanted to be in this big time curled position. What we do is we stabilize this back and put him in good posture. One, so that he understands how to maintain that, but two, so he can isolate a much better stretch through his hamstring.
Great stuff, guys. Thank you so much, Doctor. And
thank you, Jim, and thank you, Bill.